welcome to Family Doctor on iBrandTV. I am Michelle Abanum. Following the recently concluded breast care awareness in the month of October, the iBrandTV team has made a report on the state of breast cancer here in Africa. So today's episode will educate us on breast cancer, which is the most frequent cancer amongst women, impacting about 2.1 million women each year and also causing the greatest number of cancer-related deaths in women. But before we go into the report, here's what the people of Lagos have to say about breast cancer.
What I know is that when a woman is having a discharge from the breast and lump at the breast, those are just the two signs I know though, because I actually find out about that when my mom had a lump in her breast and then went to the hospital because she was scared she had, maybe it was cancer or not, but we found out it was not cancer. But most people, when they found out, is because when they have lumps or there is a discharge coming out from their breast. So
breast cancer, the little I know is that it's a symptom that develops in breast.
I know breast cancer is very serious. I know when someone tells you have breast cancer, your mind goes to dying at first. But what I know is there are different stages. There are some stages where you can be saved, where they can treat you, and there are some stages that are very critical that nothing can be done.
I don't really know much about breast cancer, but I think the awareness should be created for people to be aware of everything.
no, but my mom did, and that was 2 years ago. Yes, it is very important to take breast cancer test, especially if you are a woman and you are above 30. It is very, very important.
It's better for us to know more, that you make awareness so that many people will know it. Somebody like me, I don't really know much about breast cancer.
Report has it that in Africa, 28% of all cancers and 20% of all cancer deaths in women are attributed to breast cancer. While breast cancer is the most common cancer in women worldwide, fatality rates are highest in countries with low and medium incomes. Patients with breast cancer in Africa are often thought of as being young and presenting at a late stage of the disease. Breast cancer starts in the cells of the breast. It's a cancerous tumor that is a group of cancer cells that can grow into and destroy nearby tissue. It can also spread to other parts of the body. Some of the symptoms of breast cancer include lumps that feel different from the rest of the breast tissue. More than 80% of cases are discovered when a person detects such a lump with fingertips. The earliest breast cancers, however, are detected by a mammogram. Lumps found in lymph nodes located in the armpits may also indicate breast cancer. However, breast cancer indications other than a lump may include the thickening of other breast tissue, a breast becoming larger or smaller, a nipple changing position or shape or becoming inverted, blocking or dimpening of the skin, a rash on or around the nipple, discharge from the nipples, constant pain in the part of the breast or armpit, and swelling under or around the armpits. However, late signs and symptoms occur as the cancer grows larger or spreads to other parts of the body, including other organs. Late symptoms of breast cancer includes bone pain, weight loss, nausea, loss of appetite, jaundice, shortness of breath, cough, headache, double vision, and muscle weakness. Risk factors for developing breast cancer include being female, obesity, lack of physical exercise, alcoholism, hormone replacement therapy during menopause, ionizing radiation, an early stage at first menstruation, having children late in life or not at all, old age, having a prior history of breast cancer, and a family history of breast cancer. Genetics is believed to be the primary cause of 5 to 10% of all breast cancer cases. Women whose mother was diagnosed before 50 have an increased risk of 1.7%, and those whose mother was diagnosed at age 50 or after has an increased risk of 1.4%.
Although it is impossible to change some of the risk factors like being a female, getting older, and family history, but you can help lower your risks by keeping a healthy weight, exercising regularly, avoiding alcoholic or limiting alcoholic drinks, breastfeed your children if possible. And if you have a family history, talk to a doctor about other ways to reduce risk. The American Cancer Society recommends a mammography, that is an X-ray image of the breast that detects breast cancer, every year for women ages 45 to 54 and every 2 years for women 55 and older. Although breast cancer is very rare in your 20s and 30s, but about 12,000 women are diagnosed each year of breast cancer. Like they say, prevention is better than cure. So in the absence of mammograms, self-examination is key. That is, it is very important. And that's all we can take on today's episode of Family Doctor on iBrandTV. I am Michelle Abanom, and thanks for watching.